Well, yeah.
Thanks, guys, for coming on such short notice.
Sure, Jared. It sounded urgent.
We've learned that there are superheroes among us here at Hawaii Pacific Health.
And we know they'll be coming out super strong for the employee giving campaign.
My source was able to give me this top secret file. We just have to figure out what superpower belongs to each facility.
Let me take a look. I see Kapiolani. Spectacular!
I can find Polymomi. Grateful.
I bet I can find Straub's. Courageous.
I'll find Wilcox. Amazingly caring.
What about shared services? Huh, helpful. Thanks, that was so helpful.
Woo! Mission accomplished!
Hi, I'm Quinn and I'm 7 years old.
Quinn's condition is Say3-Chotson syndrome. It's craniosynostosis, so it's the premature fusion of her skull bone. So she's had many surgeries.
When I first met Quinn, Kim, her mother, had reached out to us and said that Quinn was really anxious about her surgery that was coming up. So what child life specialists do for patients is we bring them into the hospital and give them opportunity to have medical play.
Do you recognize this? What is this?
When you're nervous, Miss Megan has this stuffed teddy bear that is good to play with. You can fall asleep and it doesn't even hurt, and then when they put the stitches in, it doesn't hurt.
Kids always amaze me. They intrinsically know what the medical supplies are for, but seeing them be able to manipulate them and play with them makes them feel so much more comfortable and normalizes the whole hospital experience for them.
Child life is one of the most important parts, I think, of Kapiolani. It provides the children with activities, toys, games, things that help keep their mind off the pain and the fear. It's wonderful.
Chaplain services at Kapiolani is Kapiolani's way of rounding out the whole patient care. We have a 24/7 service that can provide, that can meet those needs, whether they're anticipating something or they've already experienced losses and they're grieving that. There's a place for hospital ministry to serve them if they need that spiritual care and support.
Telemedicine is definitely where medicine in general is going. We'll never lose that human connection, the patient-physician connection, but you'd be amazed how intimate a video visit can actually be and how reliable and effective it can be.
When Caden was younger, we started to notice that he had a concave chest. It just started to become more pronounced as he grew. Basically, his ribs had to be broken because they had to insert a bar through the side. About 5 trips that we went in total. After that we were just realizing it was very expensive. So when Dr. Wu's office called to say, we would like to do a checkup, then said, we have a new thing that we're trying to bring to Kauai, and so kind of a video conferencing with doctors. I said, that would be amazing.
People ask all the time, why can't I just use my phone and FaceTime or have some other kind of video conference? And while that's technically possible for social reasons, it's not really possible in the healthcare world because we have to protect our patients' privacy. There are a lot of discussions that happen there that you really want to make sure are secure and are kept in a way that nobody else can access them. So that takes a lot of support. It takes a lot of infrastructure. Having the financial support from the Employee Giving Campaign is absolutely essential to this program.
It definitely is a positive wave and a positive part of the future for Kauai residents.
Earl and I actually met when friends forced me to go out to dinner one night, and here we are more than 19 years later, and we're family.
I woke up around 2 a.m. felt nauseous, so I went to the bathroom and I started throwing up, and I thought, oh, well, I feel better now, so I went back to sleep. And around 5 o'clock, I was feeling nauseous again, and I threw up a lot more, blood.
He actually passed out and had a seizure shortly after his arrival to the emergency department because his blood pressure was low because he had lost a significant amount of blood.
I had a ruptured artery in my esophagus. That's why the blood was pouring into my stomach.
I think one of the things that was remarkable, not only in this case, but in many cases like it, is the actual assemblage and interaction of all the team members. Blood was being drawn, EKGs were being done, vital signs were being taken, his airway was being suctioned, lots of things were going on. I mean, just amazing work was done in a very short amount of time. I'm really comforted in knowing that it wasn't because they were my friends and this was my loved one, that this is the way we do things here, and it was really fascinating to watch it from the other side.
It is important that people donate money to the emergency room. It saves many lives.
The Kukua Fund here at Straub gives us the ability to support not only the patients, but the patients' family members as well, kind of when they need it the most. Sometimes we have patients that don't have the ability to have their family bedside to provide that emotional support or need assistance with things outside the normal medical treatment. I had a patient that was coming over from the Big Island. We have the only burn center in the Pacific Islands, so all burns come here to Straub. Total body surface area about 90%, so very severe, coming into our intensive care unit. Unfortunately, it didn't look like he was going to make it out of the hospital. He had family that financially couldn't afford to come over. They lost everything in the fire. So we utilized the Kukua funds to bring his wife and kids over to spend his final days with him. We were able to put them up with lodging, with food, and to spend time that, they'll never get back. We talk about, patient-centered care, and to me it's more than just the medical, it's the mental well-being. You have to do both and treat both in order for, people to successfully transition out of here. So since we weren't going to be able to help him return home, we brought home to him. It's not just we're going to help the patient, we're going to help the community, and that includes the patient and their family.